So good morning, everyone. My name is Elaine Bailey, and I'm a proud Peggy Lillis Foundation advocate as of the past couple years. And this morning I have joining with me Sarah Wang, who is a student at UC Irvine. And Sarah and I met just a few weeks ago, and she's very interested in integrating antibiotic resistance education and C. diff education into the early childhood education in California. So I'm going to with me today to talk about the challenges in educating the public about antibiotic resistance and C. diff. So I had planned, I was planning my session and hoping to get the slides into Kate by Tuesday, and then we had all kinds of great presentations on Tuesday that influenced what I wanted to, some of the material I wanted to share with you today. And given that we started a little late, I will probably just punt it a little bit, but just want to keep us all grounded that focusing on the session themes that have been developed, that we want to discuss how to develop a more aware public. I think the MAR Coalition has been working on educating both providers and the public about antibiotic resistance for going on 25 years. I think we've developed a lot of skill in doing that, but we still have some challenges that I'll share with you. So other themes of the session are: what are the key pieces of information patients and caregivers need? And again, we've tried to develop our resources that are unique to the individual groups that we're trying to educate. So with that being said, let's go ahead and, Kate, if you could advance the slide to the second slide. I want to start off again with sharing a little bit of history about the MAR Coalition, because we have been around for almost 25 years. Actually, we're working on planning our 25-year celebration. We have a meeting tomorrow to do it. And it initially started off as a multi-stakeholder nonprofit organization that sought to improve the use of antimicrobial agents in communities throughout Michigan. It's actually, our programs have been used literally throughout the world. And again, I'm so happy to have Sarah with me today from California, because it's, you know, all of our materials that we developed are available for anyone to use. As I mentioned, it was established in 1997. Initially, it was a 5-year community-based demonstration project. And it's an interesting history that I won't go into because of the lack of time, but it was initially supported by a grant from General Motors, yes, the car company, and eventually supported, or currently supported through the CDC program, the Be Antibiotics Aware program, which was formerly known as the Get Smart program. And our state health department writes for that grant, and then the MAR Coalition, myself and my media director are paid as subcontractors to the state health department. So currently, as we look, we're a volunteer organization. We have an advisory board and an advisory council. And the members are assigned to one of 3 work groups, or at least one of, they can be assigned, some members work on all 3 work groups. And you'll get a feel for what those work groups are, again, as we progress. And before I get too far, I also wanted to mention that I think Margot Farber is in the audience today. And I'm so excited that I noticed she was on the joining the summit on Tuesday, and got to talk to her yesterday. Hadn't spoken to her in several years, and have her re-engaged with MAR Coalition. So hi, Margot, if you're out there. So early on in about 2001, our legacy community-based educational program was called Antibiotics in You. And that program really serves as the template for all of our community programs that I'll share with you today. Next slide, please. So again, not to spend too much time on the background, because this audience all knows that there's definitely a need to educate the community about antibiotic resistance. In the work done by the Pew Research that was published in 2009, about 50% of the public does not know that antibiotics don't work on viruses. And when you look at those with a high school education or less, it's even a worse situation. More recently, the University of Michigan, in conjunction with AARP, did a national poll of adults age 50 to 80, and they asked them different questions, including their opinions regarding antibiotics. And in fact, 41% of those responding to the poll had indicated that if their symptoms lasted long enough for them to seek health care, that they felt that they should receive an antibiotic from their prescriber. So definitely a need to educate. I want to, the next couple slides, Sarah's going to share with you, because she's done some work looking specifically at college-age students.
Hi, everyone. So recently I did this summer undergraduate research program survey that basically tested the knowledge, attitudes, and practices regarding antibiotic resistance, antibiotic use, and meat raised without antibiotics to 200 undergraduates. And we found some really surprising statistics. So basically, juniors have 1.93 times the knowledge on antibiotics than compared to freshmen. And that's very insightful, because it means that those closer to high school level knowledge and education have far less knowledge in general, so require extra education via, for example, a freshman seminar. In addition, we found that males had poorer attitudes towards antibiotics than females. And those are very insightful and can help create and tailor future freshman seminars and education targeting the undergraduate population.
I think Sarah's work is very interesting, and indeed we worked with a couple student health centers a few years ago to develop, this is one of our MAR brochures, and I'll talk more about them later, but this one was specifically designed for college-age students, because recognizing that the student health centers get very frustrated because the college students go in demanding antibiotics because they grew up on antibiotics. So again, we have to target our various age groups and needs. That's what we try to do as we develop our resources and tools that we use in the MAR Coalition. So as I mentioned, the legacy program that was developed back in the early 2000s was called Antibiotics in You, and it really serves as a template for all of our MAR educational programs. This can be found on our MAR website, and again, I'll walk you through this a little bit later with how you can download any of our educational programs. They're available for anyone to use. But currently, our educational programs are used mostly by the pharmacy students at the 3 colleges of pharmacy in Michigan. As part of their community service projects, they're integrated in some of their curriculum, public health electives, etc. But what we've tried to do with developing our materials on our website is really focus on their needs, giving them a complete package that they're able to download from the MAR website, and very specific instructions and narrative within the presentation of how to present the program. And we are using, some of the technical things that we've evolved to, initially we had PDFs of the presentation that didn't work real well. We now use Google Slides, and that way we can edit the slide presentation at any time. We try to make this a really interactive program for all of our programs. In the elementary program, it's a lot of the focus is on hand hygiene. Not surprising. Every classroom, every year, they have to go over this again, and now it's all even more important. So we use the Glow Germ, if anybody's familiar with that. Hopefully I'm getting it in the camera, okay? The Glow Germ package, it's a lotion that can be put on hands, and, oh, my dog's also trying to get in on this. Can be put on hands, and then using this small flashlight that's also included in the package, it luminesces and you can see the fake germs on the hands. So the kids really love this. That's one of our activities we do with the young kids. We also do a balloon pop, where we put a few drops of water in a balloon, blow it up, and then pop it, showing how germs can spread 6 feet and far further. So all of those activities are described in our download package. And at the end of the program, we do have an activity sheet that's, I don't have it handy, but it's the famous, I'm sure you all seen, the Cover Your Cough, you know, colored program. They're everywhere, those posters. We actually have we've made it into a booklet, that on the back page of the booklet is the Antibiotics in You, the Resistance Ranger Pledge. So at the end of the presentation that our ambassadors do, they deputize the children as MAR ambassadors, and we have little MAR tattoos that we use to deputize the children. So again, that's nice that, you know, with the colleges of pharmacy, we provide them all with all these tangible resources too. With folks that are using our program online, you know, they don't necessarily have access to those materials, but I'm certainly willing to send them out for anybody interested. So a few years ago, we started focusing on really trying to expand Antibiotics in You for different age groups. And I'm really proud of our middle school program. I think it is a very well put together program. In this picture, you'll see a pharmacist, Caitlin Anderson, is in the lady holding the binder. It's actually a binder that we put together that has all the materials for our middle school. We have both a lesson plan and a shortened program. So a lesson plan for teachers, and I'll tell you a little bit more about that on the next slide. But this picture was taken at the Michigan Science Teachers Association annual meeting, and the person that she's presenting to actually won the MAR kit that you see in the picture also. That this was a kit that we had put together to help teachers present the elementary school program in their classroom. But he said that we had several great comments that, you know, that showed us that teachers are really enthusiastic about sharing this message. And we have been going to the MSTA for several years, obviously not for the past couple of years, but there's definitely a lot of interest in our programs. So I mentioned that not only do we have that short program that looks a lot like the elementary program in terms of how it's set up, that it's a one classroom period, but really cool that Caitlin, she spent 1 year on a longitudinal rotation with MAR Coalition, developing a teacher lesson plan for middle school teachers. And so it's essentially an expanded slide deck of what is for the shortened program. And it includes, it's broken down into 3 sections, and that each section is presented on in one class period. And with each section, there is a science-based activity that's performed that day. They're really cool, a lot of fun. My favorite one is the appropriate use activity, appropriate antibiotic use activity, where the students are given the famous CDC table, What's Got You Sick. I'm going to show it here for everybody to recognize this table. What's got you sick, bacteria, virus or bacteria. And then they are given those illnesses and have to decide if the physician appropriately prescribed the antibiotics correctly. And if the students answer these questions correctly, they end up with a 80% or 60% correct, that the physician prescribed it correctly, so consistent with the data that we see. So we've done a lot of measuring our program, looking at the effectiveness. In fact, that's another project that we have pharmacy students working on right now that are in a research elective. And for our middle school program with our MAR ambassadors, that our MAR ambassadors have presented beginning in December 2018 until March of 2020, when COVID hit and the students were no longer able to go into the classrooms. We have results, pre and post test results for over 1,100 students. And as you can see here, the average pre-test score, they had 6.5 questions out of 10 correct, and the post-test scores significantly improved to 8.24. And that was regardless of who was doing the presentation, whether it be myself or one of the MAR ambassadors, which showed us that the narrative that we provide in our Google presentations can easily be shared. And we also, on this slide, I'm showing specifically the results for question 3. And question 3 asks about our antibiotics are used to treat viral infections like the flu. And as you can see in the pre-test, about 70, I think it's 75%, because I can't really see it, but about 75% of students answered this incorrectly in the pretest, and that essentially flip-flopped into the post-test. So that was, really showed us that we are getting our message across, an important message about that antibiotics should only be used to treat bacterial infections. Okay. So I'm going to turn it back to Sarah for a couple minutes so she can talk about some of her other work.
So in California, 1 in 4 individuals are immigrants. And within this context, there is often an issue of non-prescription that is up to 100% in some demographics and 67% specifically in Latino migrant populations. But a lot of this happens within countries out immigration into the US because there are often inadequate policy regulations to restrict antibiotic prescription and antibiotic use. For example, in Thailand, you can find antibiotics in the pharmacy and just purchase it without a prescription. As a result, there is often a culture of sharing prescriptions and using it as the primary source of remediation for diseases. So there's often an over-reliance, and as a result, it is very important to address antibiotic overuse, especially in households living with 3 or more generations under the same roof. So recently, Dr. Olodele Ogunsaiten, or Dele, who is a public health professor at UCI and UC Presidential Chair, and I have been working to create an interactive storyline game to engage both medical students and undergraduates in understanding the correct dialogue that's specifically stated within the context of antibiotic prescription. Recently, a study found that adverse drug effects were stated in only 34% of communication. As a result, it's very important to highlight all the critical components of drug communication regarding stating the name, justification, adverse side effects, duration, direction, and direction for use. So this is very important in terms of increasing patient-centered care and improving health communication. And we're going to be testing that on 200 undergraduates, specifically 100 medical students and 100 undergraduates. I'm going to be passing it back to Elaine.
Really exciting, Sarah, and I'm looking forward to working with you more on that. These are some populations that we've also tried to focus on in the past, so looking forward to collaborating with you on your efforts. So in April 2020, as we were, as COVID-19 pandemic, we were all stuck in our homes, and I started to get really worried that our pharmacy students were not going to be able to present the school-age programs in the fall. By this time, we have a lot of enduring programs that they present in schools throughout Michigan, and they depend on those, presenting those programs, not only the schools, but also the university students, because it's partially as a, you know, again, it's in some cases it's part of their electives, and in other cases they just want to have practice on professional communication and communicating health messages to a variety of audiences. So as I started to get really worried that they weren't going to be able to do this in person, I started to, at the same time, I was concerned about the lack of socialization that our seniors were having. As Christian talked about on Tuesday, that you know, all the issues that we have in healthcare with seniors. And on a personal note, my parents are in upstate New York. I'm in Michigan, and my mother suffers from Alzheimer's. They live in a retirement community. They had just moved into that retirement community. And I was so happy they were there when COVID first started, and because they had their meals were provided. They went to a community dining room to have their meals. There were a lot of events, educational events, and entertainment, etc. And all of a sudden, that all stopped in April. Their meals were brought to their home. They didn't go to the community center anymore. They were basically having no social interaction. And as my mom's Alzheimer's was getting worse, I was very concerned that they weren't having any interaction. And that influenced me to think about, okay, can we put together a virtual program that we can share with seniors? Because the seniors really love, you know, they love seeing the young students, the young people. Can we do it over Zoom? Is that possible, technically possible? Would the older people struggle with the technology? But we fast forward, in the fall, I had a pharmacist who's currently completing an infectious disease fellowship, and he's also concurrently getting his master's in public health. And he did his practicum for the public health program with the MAR Coalition. And he worked tirelessly with me to put together the community education program. As you see, it's still called Antibiotics and You, but we have a very much a focus on educating in the era of COVID. Similar to our other Antibiotics and You programs, as you can see on this slide, we have speaker notes, which are in blue. And then Black, we have some additional background for the speaker. So really, our goal is that anyone could present this to an audience using Zoom technology, although we hope to also be doing it in person as soon as things start loosening up. So next slide, please. So with any of our programs, again, they're available on our website, and you see our webpage is my-mar.org. And if you go to the home page, you'll see this particular program, the arrow shows that it's under the community education. And then when you open up that, there's the web page. And again, similar to the other Antibiotics in You program, there's a complete package and instructions on how to present it. Again, the instructions were developed kind of thinking about our most common users of this is the pharmacy students, but again, anyone can use this. So I just wanted to share with you a little bit about some of the content that's in this specific to C. diff. We, as you see here, we do have the data from the 2019 report that about 225,000 cases in hospitalized patients. In the narrative, we do have them speak to the additional 225,000 that we see in the community. And then you'll see way at the bottom of the notes, we refer the students who are presenting this to the Peggy Lillis Foundation so that they can get more information on C. diff, because many of those student presenters have never heard about it yet. Another important piece that I decided to put in this today is a little bit about how we've integrated dental education around dental antibiotic prescribing into our materials. And a little bit later, I'm going to talk more about specifically about our dental antibiotic stewardship program. But as Debbie Goff mentioned the other day, there's a lot of use of antibiotics by dentists. They're the 5th most common prescriber in the US. They prescribe about 26 million courses of antibiotics each year. And unfortunately, they're also the most common prescriber of clindamycin, which many of you in the audience know that drug. It's what Peggy Lillis died from taking clindamycin after going to the dentist. So we do talk about this briefly in our community program, and I'll tell you that the message has really resonated with the seniors that we've been presenting this to in the last few months. So I want to talk about some of the obstacles and challenges we've been having, both historically as well as in this age of COVID. With our school age program, obviously it's a lack of in-person learning that's really challenging us, because the programs work best when the pharmacy students can go in there and do the glow germ activity and interact with the students. And you know, not only is it presenting the program, but a lot of times the teachers like having them in, especially in the middle school and even in high school, to talk about pharmacy as a career. So that's of course been a great challenge this last year. For the middle school program specifically, integrating the teacher lesson plan into the curriculum has been a challenge. Especially in the public schools where it's very regulated what they have to teach. In the private schools, it's a little bit easier. But I will mention that in both the middle schools and high school, the health programs really love our educational programs. So they're a little bit easier. I'm finding they're easier to get it into a health class rather than into a science class. And there's also been some challenges reaching communities distance from the College of Pharmacy. For those that know the state of Michigan, we have the Upper Peninsula that seems to often get forgotten. Fortunately, I have a MAR advisory board member that lives up in the UP, and that she's been a lot of help in getting our message out. We've also had challenges with customizing materials for the audience. As Sarah said, we have multi-generational, we have a lot of community, very large Arabic community here in southeastern Michigan. I'll show you some of the tools and that we've been developing in a couple minutes. With our community programs, I've really struggled with identifying venues. We've been lucky that we've been working with Ferris State College of Pharmacy. Their public health students or pharmacy students in a public health elective have been presenting our community programs. But whereas we initially envisioned that we would work with organizations such as the Area Agency on Aging, that there are 8 of those organizations throughout Michigan. We haven't been successful in connecting with them, or have had limited success. And so most of those students have been presenting to their grandparents and their grandparents' friends. So we haven't had the breadth of audience that we were hoping for. And there have been some technology challenges with Zoom. My parents couldn't use Zoom. I was lucky enough that we did present the program to my parents' community living center, and which again makes me think that there's definitely a market for this program out there, because I worked with the manager of the retirement community. He was very excited to do it, and they were able to easily use the Zoom technology. Again, with the community programs, also challenges with customizing materials for the individual audiences. Again, in the interest of time, I'm going to limit my discussion about this, but one of the issues we've really been focusing on in the last several years as we've been developing these educational programs are the issues around readability, plain language, and health literacy. And there are 3 separate but very related issues. Readability is the content, what level of reading grade level the materials are developed at. And we've been really trying to develop our materials at a 6th grade reading level. I'll show you in a couple minutes our main MAR brochure and how we've done that. And if for any of you that have seen like the CDC brochures about appropriate antibiotic use, you'll probably notice the difference, how we've tried to maintain our narrative in a 6th grade reading level. Hard to do when you're talking about antibiotic resistance, because immediately using that phrase brings the reading level up a couple grades. But using plain language and addressing health literacy needs, as this slide shows, 9 out of 10 people lack the skills needed to manage health and prevent the disease. So we're lucky that on our advisory council, we have a family practitioner who is a specialist. One of the special skills she has is related to health literacy, and she has really been so helpful on providing us guidance on the materials we're developing. Next slide, please. So as I mentioned, this is our main brochure. It actually looks like this, but you're seeing both pages, and we've tried to make it colorful, engaging. You'll notice the famous CDC slide, what's got you sick? Is it bacteria versus virus, as the focus as you open up the brochure. And again, the feedback we've had from this is that patients really like it. We have this out in physician offices throughout Michigan. I've been attending again, pre-COVID, I had attended the immunization conferences. They have 8 of them throughout the state every year, and that's a great audience because the immunization clinics, patients have to sit and wait after they've had their flu shot or now COVID shot. And it's a great time to talk with them about, well, if you do get sick, this is what you should know about antibiotics. So so going to those immunization conferences has really expanded the reach of our primary brochure. Okay, next slide, please. As I mentioned, languages, we are trying to, especially with our elementary programs, we've been focusing on developing materials that will meet the needs of our students that live in households that don't have English as their primary language. So on the left-hand side, you can see it's actually a two-sided bookmark. We have this bookmark in English also, but last year I had a master's in public health student develop the bookmark in Spanish. So we hope to use this really soon because he did this, finalized this last April. So did not get out into the schools this year, but surprisingly, I just got a request for our materials from a Spanish community or Spanish school earlier this week. So I hope that we get it out there. On the right-hand side, this was another MPH student who took our brochure and translated it into Arabic. So again, we're trying to really expand the tools to meet a large community need. Next page. Okay, so we have had lots of programmatic challenges in the interest of time. I think you've probably heard, or at least I've alluded to all of these. I'll go on to the next slide because I want to definitely talk more about our dental stewardship program too. This is just, on this slide, I've just shown trying to illustrate some of our successful partnerships and champions. Again, you've heard me talk about our academic partnerships, and corporate-wise, initially, we were supported very heavily by healthcare systems, health insurance, in particular, Blue Cross Blue Shield, both monetarily and in terms of programmatically. That's not so much anymore because of, the way, as Tessa said in the last session, that, these medical providers are just stretched so thin these days that they have little time to be able to contribute to our organization. But the community, we've been successful in getting our message out at health fairs, senior centers, trying to target senior living communities. Church groups are an avid audience. And I, again, wanted to mention the collaboration we have between the CDC and our state health department has been fabulous. Next slide. And this is just a picture of students. On the left-hand side is a MAR ambassador from Wayne State University. On the right-hand side is a group of MAR ambassadors and the middle school students they presented to in Big Rapids, which is where Ferris State University is. So the students love it on both sides, the young and the college students. Okay, so again, because everybody seems so interested in Debbie Goff's comments the other day, I wanted to share a little bit. I wanted to be selfish and share a little bit about what we're doing in terms of dental antibiotic stewardship. We've actually been working in this arena for going on 5 years now. I've been so fortunate to have Marie Fluent, who is a dentist, working with me the past 4 years, and she's become a very good friend. And just a really quick story, I read a paper in the Journal of American Dental Association that was co-authored by Marie Fluent and the director of the Get Smart program at the CDC, Lori Hicks. And I was like, who is this Marie Fluent? And where she says she's in Ann Arbor, and how can I get in touch with this Marie Fluent? Well, it literally took me a year to get in touch with her. And since then, we've just become joined at the hip. So we've been really fortunate that the Michigan Dental Association has embraced our message. The editor of the journal has invited us to publish a series of articles. The first one is shown here, and talking about antibiotic stewardship in the dental community. Not only, I think some of the speakers talked about this the other day, that in terms of antibiotic stewardship, as you see in that figure 1, in the hospitals, we're doing a pretty good job about this because we have a infrastructure that really supports these tenets of establishing antibiotic stewardship. In the outpatient setting, it's much more of a challenge because we have more fragmented healthcare, and it's just much more difficult. Now, when you talk about in the dental practice, as Debbie said the other day, 80% of dentists are in these small family practice groups, a single dentist, maybe a couple dentists. And one of the elements that we're really focusing on is that it's not just, we can't just get to the dentist. We have to get to the dental patient, and we have to get to all of the other employees in the dental office, because often the dentist may be the one prescribing, but the patient only sees that dentist for a couple minutes, and it might be why they're, not able to ask any questions. And so really the person at the front desk needs to know about appropriate antibiotic use, the whole dental community. So that's where, again, Marie and I have been presenting scientific series for Michigan Dental, and also at our regional, all of our MDA has regional affiliates throughout the state. And we're presenting to those regional programs too about educating the entire dental office. So this was our first paper talking about the opportunities and challenges. That was published in, if I remember correctly, October of 2019. And then the next slide was actually made the cover of the journal, which was pretty impressive because, as you see, it was August 2020 when we're deep into COVID-19. And it was titled Antibiotic Guidelines for Dentistry. We tried to, again, based upon Marie Fluent's influence, she was saying you really need to give the dentist, algorithms and charts, and, they're not going to necessarily read all the narrative, just give them their information, package it nicely. So we've tried to include lots of charts of, the antibiotics, how to use them. Again, this was concurrently with, as I think you heard the other day, that there are new guidelines for the use of antibiotics. So the American Dental Association, as part of the AMR Challenge in 2018, committed to developing guidelines for use of patients that have oral infections. And they were trying to change the paradigm and saying antibiotics don't treat pain. So in the next slide, actually in this paper, we talked about those new guidelines, but in our third paper, which you see here, which was just published in February of this year, we have specifically talked about delayed antibiotic prescribings, because this was a practice that was introduced in the new guidelines that the ADA published in 2019, and again, based upon what I've shared with you about dental practices, practicing delayed antibiotic prescribing, which is now used quite a bit in patients that have respiratory tract infections. They might receive a prescription if the provider doesn't, feel that antibiotics are necessarily appropriate. They might give them a prescription and say, "Don't fill it yet, though. Wait a couple days, see what happens with your symptoms, and then consider getting it filled if your symptoms don't resolve." So again, using the CDC tool that they had developed to support delayed prescribing in respiratory tract infections, we developed the tool that you see on the right-hand side. And again, it's a two-sided, basically the size of a prescription pad. On the front side, it talks about, so this would be something that the dental provider would give to the patient if they felt that they weren't candidates for antibiotics at that point in time, but they potentially could be. So don't get your antibiotic filled yet, and then giving guidance about when they would consider having their antibiotics prescription filled. Equally important is on the back of it is that side that says managing your pain. And the dental providers have really liked how we've included pain management, because again, as ADA says, antibiotics don't treat pain. So we've also used this as a forum to try to reduce opioid use in dentistry. So that was co-branded by the MDA, and we're really excited that we got those out in February and have had quite a few dental offices asking for them subsequent to being published in the MDA journal. So I just want to finish up with a couple things and emphasize that will also emphasize some of the things we talk about with our dental antibiotic prescribing program. This is a slide actually taken from our middle school, our short program that the MAR ambassadors present, and we try to outline the appropriate, how to properly take an antibiotic if indeed you are prescribed an antibiotic. But as you can see here, we, although we say do not save it for later and never share antibiotics, like the CDC is no longer advocating for, or let me switch that around a bit. The CDC is suggesting that if patients start feeling better during a course of antibiotic therapy, they should contact their prescriber and discuss early discontinuation of antibiotics. It has not yet gone really prime time, but on some of the materials from the CDC, for example, they've taken out the guidance to finish all your antibiotic. So we speak to this during our presentations about not saving antibiotics for later. We talk about this change moving towards early discontinuation of antibiotics. Importantly, we also talk, especially important here in the Great Lakes area, that we shouldn't be flushing unused antibiotics. And we provide them with, here in the Great Lakes or in Michigan, we have a really nice interactive website that the Michigan Environmental Health puts out that shows all the places you can return unwanted medications. Of course, most pharmacies take them back, but it's a really nice, helpful thing, especially I think when you're up in the UP. So this again is a slide that's included in our community education program, and it includes a couple concepts I wanted to just emphasize a little bit more too, in terms of how can patients be an antibiotic steward, because it's really important that we all take control of our own health and that we feel comfortable communicating with our physicians and our healthcare providers about this public health crisis of antibiotic resistance and C. diff. So we, in our middle school program and our community program, we do introduce the concept of narrow spectrum and broad spectrum antibiotics. That's also a big part of our dental antibiotic stewardship program. So we tell the patients, ask your doctor, could you prescribe a more narrow spectrum antibiotic? Can your infection be treated with fewer doses? Especially infections like sinusitis, which is typically, it's for many, many years, the guidelines have been to, only treat for like 3 days, yet the average duration of therapy is like 7 to 10 days. Similar with dentistry, and Marie Fluent and I figured out that a lot of that is because of their dental hardware is wired to write for 10 days of therapy. It's, as we heard Debbie talk about the other day, it's like a football score. Really the patient should be should be empowered to ask the question about, can I call your office if I'm feeling better in a few days, and talk about early discontinuation. So I apologize for going through all of that pretty quickly, and I'm sure I forgot to highlight some things I really wanted to, but I'm hoping that you get some ideas about how to be an antibiotic steward in your community and might be interested in using the materials that we have available on the MAR website. Of course, I would welcome anyone to contact me. As I said, although it's a Michigan program, we are happy to share our materials with anybody that's interested. Just as with our community program, we've been putting together these little goodie bags. And in our goodie bag, not only do we have our brochures, some handouts from the CDC, and most of these are also on our website. But we have little goodies. We have our hand sanitizer, and of course we make sure to tell our audiences that hand sanitizers don't kill C. diff, and that everybody should be using soap and water. We have our MAR tissues, pen, but we also have, thanks to COVID, have created MAR face masks, and even MAR face masks for children. So thanks, everyone.